Good morning, namaste, hello. I'm your friend Dr. Pankaj Talwar and I welcome you back again to our YouTube channel called Matritva. In this channel, we cover the various aspects of IVF treatment with you, and today we'll be covering a very sensitive topic. Keep contacting us again and again, and that is irregular cycles and IVF. You all want to know, can we conceive with irregular cycles? Does irregular cycles affect our fertility? And what all implications it has when we are not able to conceive? Do we require some drugs, hormones, surgery? You all want to know, does irregular periods affect our fertility? Will it hamper our treatment? Can irregular periods hamper our outcome with IUI and IVF? So today in short, I'll talk about various conditions which are associated with irregular periods. Before we go to the irregular periods, you must know what are regular periods. Every woman on average has a cycle of around 28 to 30 days, and she ovulates somewhere on day 10 to day 12 of the cycles. Every month she will ovulate a single egg, and then in case the couple is staying together that time and they have a contact, the lady can conceive. That is called a normal pregnancy. In certain cases the periods are prolonged. The periods can be less than 21 days or they may become more than 36 days in duration, and as the interval frequency of the periods say decrease or increase, we say the woman has got irregular periods. We have seen in case the duration of her periods they become shorter or they become longer, there's a high chance that she may not conceive normally in that cycle. So आप जानना चाहेंगे ऐसे क्या कारण हैं जिनकी वजह से periods can be short or long. There are multiple conditions. Some are medical conditions and some are psychological. Today we are noticing that the young women are all working and they are under tremendous stress. Whenever we are under stress and we are working around the clock, that can affect our fertility and that can also affect our periods. So the common cause is stress, which I think we can all relieve by doing some amount of yoga or meditation. The other conditions can be when the woman is having premature ovarian failure or she is perimenopausal or menopausal. Now what do these terms mean? It means that in case a woman has got very low ovarian reserve at age of 40, she may go into premature ovarian failure and she may have irregular periods. On the other hand, the women who are reaching her menopause, they are in that twilight zone which we call as perimenopausal age group, and they can have irregular periods. So all these conditions can lead to irregular periods where we are not definite about her date of ovulation, and this may delay their fertility. So the common medical conditions which can lead to delayed or early periods can be overweight or underweight. The BMI is very high or BMI is low. The other common conditions are diseases like hypothyroidism, which can be easily treated by taking some amount of thyroid medicines. There can be a condition called hyperprolactinemia, where the woman may have high levels of prolactin in the body, which may lead to early or late periods, and the other conditions can be PCODs or diabetes. So how do we proceed helping you? हम आपके लिए क्या कर सकते हैं? You have to also realize that in the woman, the interval of periods and frequency of periods is not fixed, it is variable. So in case you are having regular periods and one odd period you have long or short, you need not worry about it. No treatment is required, no medications are required, but in case you find that your periods are getting early or prolonged for many months, then is the time when we have to intervene and put you on some sort of oral contraceptive pills. So our main concern is in the young women who have got either short cycles or long cycles. They are worried. What can we do to help them? It's actually very simple. The women who have got long or short cycles, we should treat her metabolic diseases, we have to treat her thyroid, prolactin, we have to treat vitamin D deficiencies, and we have to rule out PCOD or PCOS and put her on some medications which can regularize her periods. Then we have to establish the date of her ovulation. And how do we do that? आप कब ओवुलेट कर रहे हैं ये आप घर में अपनी जांच खुद कर सकती हैं, और इसे करने का तरीका होता है इन केस यू यूज LH किट्स. एक किट आती है मार्केट में जिसे वी कॉल देम LH किट्स, एंड इन केस यू put some urine on that kit, you will be able to know whether you have ovulated or not. This can be done for 2 to 3 days at the time of ovulation, and you can actually know when you are ovulating. The second method is that you can plot your basal body temperature, and this will tell you the moment your temperature goes high by few degrees, you come to know that you have ovulated. The most definite method of our establishing your ovulation is by doing an ultrasound. When we do serial ultrasounds, we come to know, we follow your follicles, and as they become more than 2 centimeter, we are sure that you're going to ovulate very soon. And when we do an ultrasound for you after 24 or 36 hours and we find that that follicle has disappeared, we know that you have definitely ovulated. So as a gynecologist, as infertility doctors, how do we manage you? What we do is that when you come to us on the second day of the periods, whenever you have your periods, the periods can come either naturally or we can give you some tablets to get your periods. So when you come to us on day 2 of the periods, we carry out some basic tests for you, and these tests are FSH and AMH, and then we also carry out an ultrasound for you. After this, we'll put you on some tablets like clomiphene or letrozole. In case you take letrozole or clomiphene for 5 days, I am very sure that we can be quite definite that you will be ovulating after 7 days of taking these medicines. In case we fail, then again we give you these tablets and carry out your serial ultrasounds and establish the day of your ovulation, and then you can have spontaneous intercourse. Many times, even after giving you clomiphene or letrozole for 5 days, we don't achieve ovulation. तो हमें ऐसे केस में क्या करना चाहिए? In such cases, along with letrozole or clomiphene, we add certain hormonal drugs. They can be FSH or HMG, and you take them for 3 to 4 days after taking 5 days of clomiphene or letrozole, and you'll find that we can actually achieve very good rates of ovulation, and then you can go in for either time intercourse or you can go in for IUI. In case everything fails, though it is very rare, but sometimes everything fails, in such a case you can go in for IVF too. So what we realize is that you need not worry about irregular periods. The periods can be short or long. Few irregular periods, don't bother. So we have learned today that irregular periods are quite common in the woman. They are quite common in the young women as well as the women who are moving towards perimenopause or the women who are going into premature ovarian failure. You need not worry about these conditions. They are totally treatable and they are very common. It was nice talking to all of you. मुझे पूरा भरोसा है कि आपने आज कुछ सीखा होगा और इसको आप अपनी ट्रीटमेंट पे अप्लाई कर सकते हैं. अगर आपको हमारा वीडियो अच्छा लगा, इसे प्लीज़ शेयर करें और सब्सक्राइब करें. It will help lot of women around you who have similar problems. We are available for you 24/7. You can reach us on YouTube, LinkedIn, Instagram, Twitter. Thank you so much. It was wonderful being with you, and soon we'll meet again with a new query from your side. Till then, goodbye.